views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Welcome back to another episode of My Story Living with Lupus. I'm your host, Susan Hendricks, and I'm so glad that you could join me on this Friday. First of all, I would like to say welcome to all of my listeners on iHeartRadio. Today's episode is about CFID. And also, I'm doing a giveaway. That's right. I'm doing a giveaway. So I want everyone that can hear my voice to participate. Now, you know what I want you to do. That's right. Grab your cup of coffee, your cup of tea, and if you're listening late at night, you know I appreciate you. So grab your favorite glass of wine and come on and join me right here on My Story Living with Lupus. Abundant Harvest Aquaponics, planting seeds to grow food and creating opportunities for people and families. You can contact this nonprofit organization at www.abundantharvestaquaponics.org. Motivational speaker, entrepreneur, and creator of Right Side of 50, Life Lessons with Sheila Smith. To book her for your next empowerment conference, contact her at rightside50@gmail.com or call 404-447-6897. Let's get started talking about CFIDS. Do you know what that stands for? I'll give you a few seconds. Okay, time's up. CFIDS stands for Chronic Fatigue Immune Dysfunction Syndrome. Now, CFIDS and fibromyalgia syndrome are still labeled as fad diagnosis by some less enlightened practitioners. But these two related conditions, suspected to be autoimmune in nature, can cause varying degrees of muscle and joint pain, fatigue, exhaustion, and depression, and are very real for a combined total of at least 8 million sufferers. Both CFIDS and fibromyalgia can share some similar symptoms: fatigue, pain, concentration difficulties, and sleep disturbances. They are also both difficult to diagnose and treat. Some practitioners suspect they are related or are perhaps even manifestations of the same metabolic dysfunction. Chronic fatigue immune dysfunction syndrome, sometimes referred to as chronic fatigue syndrome, or by the British European name myalgic encephalomyelitis, is a chronic inflammatory illness of undetermined origin. There is some medical evidence that CFIDS is an autoimmune in nature. The American Autoimmune Related Disease Association has identified it as autoimmune due to the inflammatory nature of the condition, coupled by the fact that more than half of those with CFIDS who are tested are positive for circulating anti-nuclear antibodies, better known as ANAs, a marker for autoimmune disease. There is no definite test for CFIDS, and the diagnosis is more of an exclusionary process of ruling out all the other possible causes of chronic fatigue while documenting markers and common CFIDS symptoms. While CFIDS affects an estimated 1 to 2 million people, it's thought to strike more than twice as many women as men. Now, all ages, races, and income levels can be affected. It's not considered to be a contagious condition in the traditional sense, although there have been cases where CFIDS appears to have struck groups of people geographically. The theory is that a viral trigger combined with a genetic susceptibility may be the cause of CFIDS. Initially, there was a theory that CFIDS was caused by the Epstein-Barr virus because the symptoms were so similar to mononucleosis. Subsequent research, however, has been unable to establish a direct cause-effect relationship between the Epstein-Barr virus and CFIDS. There are also researchers who suggest that chlamydia may be responsible for CFIDS. But what we do see, however, is that CFIDS frequently starts with some sort of infection and illness in some cases. Epstein-Barr infection, mononucleosis, pneumonia, diarrhea, or an upper respiratory tract infection. While fatigue is not uncommon in most of these conditions, after the infection seems to resolve, in CFIDS, the fatigue remains. Now, according to CFIDS, and FMS patient advocate Lisa Lorden, Director of Communication for the National Fibromyalgia Awareness Campaign. There is no consensus regarding the epidemiology of chronic fatigue syndrome and fibromyalgia. A number of studies have suggested that CFIDS may represent a dysfunction in the hypothalamic pituitary adrenal axis, since physical or emotional stress is common in many CFIDS patients before the onset of the condition. It's not been thought that the HPA axis is activated, causing cortisol levels to drop. Not so significantly, that levels become abnormal, but to low normal levels or levels that are low relative to an individual's previous readings. Since proper levels of cortisol suppresses inflammation and the immune system, these reduced levels may allow for inflammation and imbalances in the immune system. When we come back, we'll have more, so stay with me. Now don't you go anywhere. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. He is the author of Positive Energy 24/7 and his latest book, It Was Destined, Urban Legend. He's Detroit's own author, Henry Long. To purchase an autographed copy of his books and to purchase his ebook, go to WritePath247.com. That's WritePath247.com. You can also follow him on Instagram at WritePath247. When it comes to the symptoms of CFIDS, primarily the main symptom is unusually debilitating fatigue that lasts at least 6 months and forces you to reduce your activity level substantially. CFIDS expert Dr. Jacob Tettelbaum describes the onset of the condition as frequently starting with a bout of flu-like illness, which then converts to extreme fatigue. Other symptoms found in CFIDS include prolonged fatigue after physical activity, known as a post-external malaise, usually lasting more than 24 hours. Fatigue with or after normal activity, or fatigue after sleep, unrefreshing sleep, mild low-grade fever or chills, dry, inflamed, sore throat, swollen or tender lymph nodes in the neck or armpits, general muscle weakness and pain, generalized headaches, pain that moves from one joint to another without swelling or redness, forgetfulness, difficulty remembering or saying words, excessive irritability, confusion, or inability to concentrate to the extent that it interferes with your job, education, social, or personal activities. More frequent illness with susceptibility to infections, viruses, or worsening of allergies. Neutrally medicated hypotension. When you stand up, your blood pressure drops, which can make you feel faint, dizzy, nauseous. Your heart rate drops, and you can even pass out. Now, to my listeners who are suffering with lupus, does any of these symptoms sound familiar? Reactivity to environmental exposure, increased sensitivity to chemicals, perfumes, odors, bug sprays, etc. Night sweats, hypersensitivity to temperatures, sounds, sensation, confusion, gastrointestinal problems such as diarrhea, constipation, and bloating, feeling cold. One chronic fatigue patient, Laura, described the condition as feeling like having the flu for 20 years. Now, when it comes to diagnosis, after ruling out all the possible causes of chronic fatigue, including lupus, MS, Lyme disease, adrenal disorders, HIV or AIDS, thyroid disease, rheumatoid arthritis, depression, cancer, and other conditions, there is particular criteria that is applied to make CFIDS diagnosis. These criteria include new onset of fatigue lasting 6 months and reducing activity to less than 50% of usual, plus at least 8 of the following symptoms: mild fever or chills, dry, inflamed, sore throat, swollen or tender lymph nodes in neck or armpits, general muscle weakness, general muscle pain, prolonged fatigue after physical activity, known as post-external malaise, usually lasting more than 24 hours. Generalized headaches, particularly headaches of a new type and pattern and sensitivity and severity. Pain that moves from one joint to another without swelling or redness. Forgetfulness, excessive irritability, confusion, or inability to concentrate to the extent that it interferes with your job, education, social, and personal activities. Sleep disturbances, unrefreshing sleep, waking up exhausted after sleep. Now, I know you want to know about the treatment. Conventionally, some physicians would say that there is no treatment for CFIDS. since they don't really know what metabolic, immune, or infectious mechanism is at work to cause it. There is no treatment. Some physicians, however, have successfully used drugs such as Ritalin, the drug typically used to treat children with attention deficit hyperactivity disorder, with some success. In patients who are going through this, I have been told that when they see their doctor, they tell them that it's all in their head, that there's nothing wrong. How could a practitioner say something like that to a patient who knows their body, who knows what they're feeling? Now, I've known several people who go and have massages done, and they said it works wonders for them. So, that's it for CFIDS. Now, myself, I do believe that, lupus triggers a lot, just like fibromyalgia. Now, I was told at one point from a physician, and I've stated this before in previous episodes, that once they had a clear diagnosis of the lupus, they told me that eventually I would wind up with fibromyalgia. And it occurred. And this particular practitioner told me, I'll give you five years, you'll be full blown with the lupus. Well, 5 years, yes, I'm full blown with lupus. And they put me on hydroxychloroquine, which is Plaquenil. And now I'm no longer on Plaquenil because my body, it took me through changes with my body, and I can no longer take anything for my lupus. So as of this point, I'm not on any lupus medications. Now, when we return, guess what's going to happen? Well, I'm going to tell you about what you have to do for the giveaway. That's right. So be sure to come back and listen so you can get this gift. It's a really nice gift. So stay tuned. Okay, this is about the giveaway. I'm giving it away a Laura Mercier bath gift set, which includes perfume, body wash, and it's 2 full-size jars of body scrub. Now, what you have to do to win this item is follow my story, Living with Lupus, on IG. Tag 2 friends would like for you, the participants, to email me a positive and motivational affirmation. You would email me at mystolybwithlupus@gmail.com. The contest starts today, Friday, September the 6th at 12 noon and will end next Wednesday at 12 noon Eastern Standard Time. So you got that? The gift set is pictured on my story, Living with Lupus IG page. And that's all you have to do to win this gift set. The winner will be announced on Friday. Next Friday. So there you go. The contest rules for the giveaway. I'll repeat it one more time. You must follow my story, Living with Lupus, on IG. Tag 2 friends. You got that? Contest starts today at noon Eastern Standard Time and will end this up and coming Wednesday at noon Eastern Standard Time. The winner will be announced on Friday. All you have to do is email me that positive and motivational affirmation. Before I go, I want to leave you with an affirmation I use myself each and every day. You see, because I place my hope in the Lord, my strength is renewed. God's power works best in my weakness. God is able to do immeasurably more in my life than I can ever imagine. And most importantly, by His stripes, I am healed. Never give up hope and never give up faith. I'm Susan Hendricks. I hope that you found this episode informative. I wish you a most peaceful weekend and blessings unto you and yours. I'll see you next week for another episode of my story, Living with Lupus. The views and opinions expressed on my story, Living with Lupus podcast, represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, Consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved.
The podcast you just heard was made using Anchor. Ever thought about making your own podcast? Anchor makes it really easy for anyone to get started. It's a one-stop shop for recording, hosting, and distributing podcasts. Best of all, it's 100% free. Sign up now at anchor.fm/new. That's anchor.fm/new to get started.